Whilst we're continuing our conversations from Arab Health 2024, we'll be shifting our focus towards genomic testing. And to talk to us in greater detail about this, we're very kindly joined by Dr. Angela George, who is a clinical director of genomics at the Royal Marsden. Well, thank you very much for joining us. If you can talk to us about genomic testing and how does it all work?
Sure. So genomic testing is about using both the inherited changes that people can develop that increase their risk of getting certain types of cancer, as well as the molecular changes that occur just in their tumour to inform both diagnosis, prognosis, and the best treatment options available for patients.
And in terms of its availability, what do we know about its availability and its capacity to fight cancer?
Sure. So we know that the availability of this is quite patchy, both in various countries and around the world. So we provide comprehensive testing both for inherited and non-inherited changes, as well as circulating tumour DNA. But this is not universal, so the type of testing people are offered and how much they can benefit depends on where they're treated.
And in terms of the care, the level of care provided at the Royal Marsden, you're here at Arab Health. What have you been talking about in terms of sharing the knowledge?
Sure. So we've been trying to explain to people the benefits of genetic testing in terms of making sure patients get the best possible treatment with the fewest side effects that is most likely to be beneficial for their cancer, so personalised medicine, but also about being able to define who has an inherited gene alteration and who may be at risk of other cancers for their future. So it's about raising awareness of the benefits of this testing and the difference it can make to patients.
And what kinds of reception have you received over here in terms of people's acceptance of this level of treatment?
I mean, I think it's been very positive. I think for many people these are relatively new concepts, and I think the awareness of how much benefit it can provide to patients, again, is quite patchy. But people are really engaged when they find out what a huge difference it can make to patients in terms of preventing future cancers in the families and in their population as a whole.
Well, Dr. Angela, thank you very much for joining us today.
Thank you very much.